Hi, show yourself, Michael, audience member. I am dressed to fit my target audience, like you asked. I would be giving this to coaches, so I dress kind of like how I think a coach would dress. So here we go. A lot of people do exercises. Now there are different exercises. There are from weightlifting to cardio to football to kickboxing. Now what a lot of these exercises, everyone who does an exercise has one fear, the fear of injury. Now, there are many ways to prevent injury, from stretching, weightlifting, diet. None of these are wrong, but there's a scientifically proven better way to reduce injury possibilities. Now, injury comes, and this magic is called RPR, our Reflexive Performance Reset. Now, after 4 years of using Reflexive Performance Reset myself and thorough research, I can say you will leave here wanting to know more about RPR. Now, what is RPR, you might be asking? Now, according to reflexiveperformance.com, RPR is a series of wake-up drills utilizing specific reflex points that help restore proper functional movement by resetting harmful compensatory patterns. What it means by that is RPR just keeps yourself from compensating. Now, if my right leg hurts and I want to use my right leg hurts, my body is going to make me use my left leg more often than my right leg. Now, that shouldn't be a problem. Now my right leg should heal, right? But then you're putting double the amount of strain on your left leg, causing the injury to occur on your left leg instead of your right leg. Now RPR just makes it so that you use them both equally, even if the right leg is a little damaged. It'll be better in the long run. Now, now that you know what RPR is, how do you do it? Well, first off, you start by breathing. When you breathe, put your hands on your hips and you breathe through your stomach and out your back. Now, not a lot of people know that, but your lungs aren't just in your front. Your lungs are in the middle of you. So there should be movement coming out from the back. Next, you raise your arms through a power pose and bring them down. And you're just stretching yourself out, making yourself bigger. Now, there are a lot of reflex points shown by here. Now, here you have a lot of these are just the wake-up drills. You go through these, you go through a series of 5 seconds to 7 seconds. You start off with breathing. Which one controls breathing? This one, right here, your sternum. You rub your sternum right along here. As the visual aid shows. And then here's another one, glutes. Glutes would be the back of your head, right where basically your spine connects to your head, your skull. There are many different wake-up drills as seen, and these are called Chapman reflex points. Now, Chapman reflex points are stated by Professor William H. Devine in a presentation. He says, a system of reflex points that represent as predictable anterior and posterior fascial tissue texture anomalies assumed to be reflexations of visceral dysfunction or pathology. But what he's saying by that is, every single one of these are Chapman reflex points, because Dr. Frank Chapman in the 1800s found not just these, but a bunch more reflex points that activate your muscles and your neurons. Now, there are many studies, like what backs this? Well, I'm going to talk about one back in 2011 by Ryan Garrow, who was a grad student in Merrimack College at the time. Now, he had his baseball team. 10 of them do RPR and 10 of them not. And they went through a FMS, or a functional movement screen. The functional movement screen isn't a pass or fail test that just calculates your score. And based on your score, you're at higher risk of injury or not. The scoring is out of 21, and a lot of studies show that 14 or lower is at high risk of injury. Now, back to Ryan's study. He had 10 people not to use RPR, and 10 people use RPR and go through FMS. On day 1, right off the bat, the people who used RPR had a significant change, significantly better than the guys who didn't use it. But on day 2, when they didn't use RPR, both groups that didn't use RPR, everyone was about the same and it went back to normal. Now, from there, you can say a lot of things from everything we've learned. RPR, based on this scientific research, doesn't only reduce injury, but also increases performance. Now, how we figure that out? Well, 99% of the time, when someone does good in the FMS, or the functional movement screen, they do really well in performance tests. So, if functional movement screen, higher score in functional movement screen means higher performance, then RPR then helps with performance. Now, what coaches use this? What people use this? Cal Dietz is the head strength coach for USA Women's Hockey Team. And she said the biggest secret in sports performance today is RPR. Now, she's saying this because the elites, the best of the best, are trying to keep this from people because they want to stay the best of the best. Now, another way to look at RPR, seen from like a leading guy known as JL, says another way to think about it, RPR is rewiring your nerves so that you can fire the right muscle at the right time. Now, if I were to lift up my leg and push down and try and resist, what happens is my back fires, then my glutes, then my leg. But what needs to happen is my leg needs to fire, then my glutes, then my back. And that's what RPR does, resets it. Now, another coach once said, when coaches are haunted by hamstring injuries, they find a way to prevent it. That was Tony Holler. And that's what RPR does. If there's a way to prevent yourself from getting injury, from your athletes from getting injury, then wouldn't you want it? That's RPR. That's what it does. It keeps your athletes on the track, in the weight room, on the field. It keeps everyone where they want to be. So, and that's what RPR is.